There is always a challenge, even with a very clear and impressive result, regarding the affordability, the access of the patients who need the treatment to the treatment. In other words, there is often a challenge of bridging the cost so that patients can receive the most effective treatment. The NOACs are expensive for some countries, and this is not surprising because it costs a great deal to evaluate these drugs. In 4 or 5 years from now, the patent life will expire and these drugs will become generic and their use will become much wider. So whilst we say and we agonize over this concern about affordability, I'm very, very optimistic. This is the way that things go. Show that the treatment works, the uptake initially where you can afford it, and in the long term it becomes very, very widely used when the drug becomes more affordable. Whenever we have a major advance in antithrombotic therapy, we also need to consider what are the unmet needs. The obvious unmet need is we do need to reduce the burden of bleeding. Even when there is a clear net benefit, even when the ultimate measure of net benefit, mortality, is reduced, we need to reduce, if possible, the chances of experiencing bleeding, and in particular gastrointestinal bleeding. So one approach that is necessary is to try to prevent these bleeds with other therapies. There are other areas of bleeding research that are urgently required. We need to better understand risk factors. We need to better understand whether there are other ways that prevention can take place, and we need to develop new approaches to the treatment of bleeding. But that is all for the future. For the moment, the results are clear. The unmet need is firstly to get the drug to the patient.